Hey, I'm JD. Welcome to my channel. Please subscribe. Please hit like. Today I'm going to do kind of a breakdown of what I went through for a total hip replacement. I'm in my mid-60s, exactly in my mid-60s. I was a golfer until 3 years ago, and I did use my hip quite a lot in the early years of my life. I was very active athletically. I'm not sure if that even mattered. But I ended up with osteoarthritis in my hips. My mother had it, my brother has it. So I think there's DNA involved in this. And my hip just started getting more and more sore as time pressed on. I got to the point in golfing where it just became too painful to even swing the club and rotate my body. And that's at that time I ended up quitting golf. Still working, however. And I went through 3 years of pain prior to getting my hip replaced. So the first year of pain, I was not walking with a cane. I was walking and kind of limping, and it hurt a lot. I was aching. I could tell the weather. It's like Granny on the Beverly Hillbillies. I needed rheumatism medicine because I could tell you exactly when the rain was going to hit based on my hip. And in fact, I had the humidity and general air pressure I was measuring, and I could tell you exactly when my hip was going to start hurting. So, and I put marks on those gauges to tell you, to say, okay, today's going to be a bad hip day. So I got kind of sick of it after 3 years. I guess in year two, I said, okay, I need to get this fixed, but I knew that I couldn't get it fixed while I was working full time. So I said, let's take some time off and do a semi-retirement here, and get this hip fixed. And let's go through the stages of what I did to get to the surgeon. The first stage of this is an assessment. So you've got to get your doctor to agree that you need to get an assessment. And then here, this is up in Canada, you go to the hospital and there is a physiotherapist who's trained in assessing whether you actually have a hip problem or not. And the first thing they do is they send you off for hip x-rays. And they can tell from the hip x-ray what condition your hip is in. And we're just going to talk about the left hip right now because the right hip also has problems, but it probably has a year or two before I need to do anything about it. So the left hip, there is a number that they assign to how bad it is, and the number is 1 to 4. 4 is bone on bone. You basically have zero cartilage left in your hip, and you're bone on bone. And I'm sure, and it just progresses from 1 to 4 till you're bone on bone. So I was a 4, and there was no question in the mind of the physiotherapist that I needed to have a total hip replacement. And this is what they call it, a total hip replacement, which is a prosthetic, I think is a word. And I'm not a medicine guy, I'm an engineer. So anyway, it's a prosthesis that is implanted into your hip, and I'll see if I can get a picture up a little later. But the prosthetic is what's implanted in your hip. So the first stage was the physiotherapist saying, yep, you need to do a total hip replacement. And physiotherapy and all the rest won't help you at all before the total hip replacement to get rid of the pain. It does help for flexibility. So I was told that, yeah, continue with your physiotherapy, continue building up strength in that leg where the total hip replacement is going to take place. Because when you get the total hip replacement, those muscles are still there, and if they were strong before, they're going to be strong after, and you're going to need them. So if you have weak muscles and ligaments that are holding that hip in place to start with, and you haven't done any exercise because of the pain of the arthritis in that hip, then those muscles are getting way too weak to be of any value once you get the hip replaced. So you do the physiotherapy and they tell you exactly what you need to do. So that's the first stage, is getting the assessment and continuing with your physiotherapy. So the next stage is once you get to see the surgeon, you have the chat. So the surgeon will look at the x-rays and will look at the results of what the physiotherapist has said about your condition. And we'll talk to you about your activities in general, what you do, what sports, or do you just walk around, do you cycle, how active a person are you? And in general, they need to know your health level as well. So they're going to need blood work on you. They're going to need to know lung work. They need to understand your cardiovascular system, whether that's working properly, whether you have any allergies, are you susceptible to any problems with surgery, Have you had past surgeries? So they go through a very rigorous interview process. Plus, they hopefully have all your medical records and are able to assess them all. And then you get a score for surgery. So they basically tell you whether you're a 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. They give you a score for surgery, and if you're above a 4, there's no issue. Then you're a candidate for surgery, and they'll go ahead with it. If you're a smoker, it becomes an issue. I'm not a smoker. If you're a drinker, it becomes an issue. I'm not a drinker. If you take medications that could cause problems like bleeding and those sorts of things, that becomes an issue. So all the medical things that are necessary for a major surgery like this need to be dealt with. And I would consider this a major surgery, as it's pretty invasive, even though it's not getting into your organs. But it's quite a major surgery, I think. So your complete health is assessed before they say, yes, you can go into surgery. There are people that go into this surgery that aren't very healthy. It's advised to lose weight, so lose a lot of weight. And the reason for that is the way they do the incision for the total hip replacement. They don't want to do an incision where there's a fold. So if your stomach is hanging over what we used to call a Dunlop, your stomach Dunlops over your belt. So if you've got a Dunlop, then they can't do the incision over that Dunlop because there's likely going to be infection where that fold is, because the fold is not getting exposed to air, oxygen, whatever, and the healing of the scar will be very difficult. So they have various approaches for surgery. So they can do an anterior approach, which is what they did for me. This is where they go through the front. But if you weigh a lot and you've got a big old Canadian beer belly, then they could go through the back or the side. If they go through the front with the anterior approach, they actually just move the muscles and ligaments aside to remove your femur, to cut the head off and insert the big giant spike for one part of it, and with the ball on it, and then the cup that's part of your skeletal system. So they do that through the front, which is a lot quicker. I guess there's a sac that protects the joint as well. They have to cut that open, but that'll heal. If they go through the side or the back, posterior approach, then they end up having to cut muscles, and then that takes a lot longer to heal and likely is more painful, and there's likely a lot more bruising. So for me, I did the anterior approach. This is a more common approach. So if you have the opportunity to do the anterior approach and you don't have a weight issue, then go for that approach. If your doctor says, no, we do posterior, get another doctor. Do the anterior approach. It's a much, much better approach. So you'll get your assessment by your surgeon to tell you whether you're ready for surgery. And a week before surgery, if you're taking any medications that would harm or cause a risk during surgery, they'll tell you to stop those medications unless they're critical for your health. Or if you're taking vitamins, you have to stop all vitamins except for vitamin D and vitamin C, I think, a week before surgery. So, and as well, in preparation for surgery, the day before surgery, there needs to be an 8-hour gap between the time for eating. So you have to stop eating 8 hours before you arrive at the hospital, and you're arriving at the hospital approximately 4 hours before they conduct the surgery. So let's talk about that process for a second. All right, equipment. I'll go to equipment. So before you go into surgery, you better be ready at home. So you're going to have to climb stairs likely. If you live in a home, you may have to climb stairs. You're going to have to be mobile in the house after surgery. So you're going to need a few things. You're going to need a good solid walker. I went through a couple of Amazon sites to look at walkers, and they had a walker that had handles on the top and kind of a step down handles on the bottom. It was crappy and not solid. It cost like $85, but it was a crappy walker. It just wasn't solid. So I ended up buying the $58 walker that was very solid. So you need a very solid walker. Look on Amazon for all the stars. If you get something that's been purchased 6,000 times and it's got almost 5 stars, you know it's going to be good. So you need a good walker. You're going to need a chair for the bathtub. I just bought the chair for the bathtub, although you can get an extended chair where the chair seat goes over the edge of the tub itself, where you can sit down on the extended seat and then shimmy yourself into the tub. I have no issue getting into the tub. And within the tub, I bought a handle grip that grips onto the actual side of the tub, and it's pretty serious looking steel loop that you grab onto, and then a wall grip, and it's kind of a plunger thing that you stick onto the wall, and that helps you grab or hold onto that. I don't trust the wall grip that much, basically because it could lose its grip and then you could fall down. So I have a little trust, which means I don't hold it that hard. I just hold it very lightly. But the tub grip is really good, and maybe I'll put links for this equipment up. So you need those two things. You need a grabber, which is if you drop something or you have to put your pants on, you need to grab down to put those pants on. And after surgery, you can't do that. My wife was helping me, but I do have a little grabber now that I can just reach down and grab the pants to help you get up to past your knees and help you grab that to get dressed effectively, right? So you need a grabber. What else do you need? Good to have with your walker if you've got a cup holder or a basket or something, because you're going to want to grab things as you go by your fridge. You're going to want ice packs. So I recommend getting 4 ice packs that are good size, because you're going to be putting the ice packs largely under your butt. And you're going to want to rotate them because you're going to be icing the muscles that are there that are sore. I wouldn't recommend icing where the scar is. So you're going to need an ice pack beforehand. Speaking of the scar, you're going to need, the scar ends up being about a 4-inch scar is what I have. And you're going to need a bandage set. So make sure the bandages are long enough to fit over the scar that's happening. You're also going to need a kit for cleaning prior to the operation. And they'll tell you what that kit is. And it's a special type soap that they use. It's a disinfectant soap. And you end up showering the night before surgery and using that soap. And you don't use the soap in the genitalia, you use it everywhere else. And then you shower the morning before surgery as well, before you go in, so that the most that they can disinfect you, the better for controlling any kinds of infections that might happen, right? The probabilities of infections are fairly low, but you got to make sure you're always washed and clean. So you need that as well. I ended up getting 2 walkers, by the way, which was a good plan, because one I use to get to the stairs, and then I use my cane to get up the stairs. And then when I'm up the stairs, I have the second walker that's ready to walk around. So if the walkers are $58, buy 2 walkers, and you can always give one away and keep one for when you turn 90, right? So buy 2 or borrow, because you can borrow walkers as well. That equipment. I'm trying to think of anything else I need from an equipment perspective. A good chair to sit in. Right now I'm sitting in a lazy boy chair, and it's got an automatic leg rest which goes up, and actually it's really comfortable. I've had no pain on my hip. So, and we'll talk about medicine a little bit later. So I think that is the equipment I needed to purchase. So I've got the chair I purchased. I got the walker I purchased. I've got the bathtub grip thing for the edge. It's a big metal grip to hold on to for getting in and out of the bathtub. And I've got the bathtub kind of a handle that sticks onto the tiles of the bathtub that goes higher, and you have to adjust that. And also you want to buy a 4-wheel walker for later. So I've heard that folks that get this operation, if after, say, you can drive somewhere between 4 to 6 weeks after the operation, if you can walk without a cane after 4 weeks, that's great. But going up to walking, if you're walking with a cane, it may screw up your walking. You may end up with a limp. So you might as well get yourself a normal walker that's got the 4 wheels that you can walk with. Put a little tiny bit of weight on it, and it'll keep your walking symmetrical as you're walking. So the other thing is, get yourself a really light pair of shorts that are going to be very easy to wear, put on, take off as you heal effectively. And even when you go into the hospital, it's a lot easier to deal with shorts. And make sure your shoes, if you got a pair of shoes, tie them down. If they have shoelaces, tie only the bottom 2 laces of the shoe and use them as slip-ons. And that way you don't have to lean down at all to put your shoes on. And socks are they're a little bit of a pain, but you can use the grip thing to grab socks. So make sure you've got all that equipment. So now it's the day of surgery. You've arrived at the hospital, and you're fairly anxious. So I'll tell you what happened to me. So I booked into the hospital. Had all my paperwork. They're very friendly at the hospital here. The first thing they did is they sent me to this waiting area, and it was day surgery waiting area. And what I was considered for was a hip replacement, was day surgery. They do send people home the same day, but if you can afford it, I'd stay overnight because there's a lot of medicine that they give you, anti-inflammatories and medicines that prevent infection and other things while you're there. But they sent me to the day surgery waiting area. My wife went with me. And within probably 10 minutes, they rifled me over to pre-op. So this is a group of people that hook you up to all the machines, make sure you've got a decent heart rate, make sure that you've got your blood pressure isn't through the ceiling. And they start you feel a bit relaxed there. The folks there are very nice. They may take a pre-surgery x-ray. They didn't for me because they already had a recent x-ray that they didn't need to do anything there. So you'll lay in a bed that's basically the bed you think you're going to be operated on, but it's not. So you'll lay in that bed for quite a while as they stick stuff in you. So the other thing they do is they'll stick a needle in the back of your hand and they'll start giving you a saline solution. So they make sure that you're well hydrated for the operation. The other thing they do is before you go, they tell you that you can drink a glass of apple juice or orange juice 4 hours before the operation to get your sugar level up too, because they don't want you passing out. Didn't do it fast enough, but by the time they stuck that needle in my hand and were hydrating me, they said, "Well, too late for the ginger ale, buddy." So so that didn't happen, but they were hydrating me there. So, and that was pretty much it before before I went into the blocker. So that area there is just making sure your vitals are solid prior to your surgery. At that time, your surgeon may or may not visit you. And when their surgeon does visit you, they will ask you again which leg is going to be operated on. And you got to be very honest. Don't joke around. I said left leg, and I pointed to it. And then what they did is that they marked that leg. He came in with a marker and made some marks on that leg. And I'm not sure if it was coded or not, but he made sure you got the right leg and it was marked. The other leg was not marked. Oh, and you also have to put on the schmuck with open in the back. So make sure you tie that up so you don't scare all the other people out of the hospital by having that back end open and getting whistled at when you walk. So the surgeon will visit you. Make sure they'll ask you whether everything's okay. The nursing staff are always asking you okay, and you're a little nervous, but they'll tell you to breathe. I wasn't that nervous because I've got a sense of humor, so I was kind of having a good time. And then we'll go through the next step. So next step of the operation is they'll give you, they don't call it an epidural, but it's the same thing as an epidural. It's a nerve blocker. So I'm laying in the blocking group because there's an actual group that takes people in to inject you with the blocking agent. It gets injected in your lower back, in your spine, and it affects the lower bundle of nerves that effectively makes your body from the waist down is completely, you can't feel a thing. It's completely numb. So it blocks that complete branch of nerves down there through this nerve blocker. So they said, well, this might hurt a little, but it might be a pinch when they put the nerve blocker in. So they said, sit up and sit on the edge of your bed. And I sat up and sat on the edge of a gurney, I think, not a bed. And then they said, this might hurt a little. It didn't hurt at all. So they just freeze it a bit, put the nerve blocker in. And then another gentleman came over and he unplugged the syringe thing that's in my hand. That thing stays in your hand for almost 2 days. And then he plugged some stuff in. He said, this is going to be a mix of vodka and I think whiskey and some other stuff that'll make you feel good. But he was joking with me, but it's a series of chemicals that allow, it basically causes you to not really be there. So he said, you may be cognizant during the operation, but you won't care. This is what he said. So for me, I had that mixture put in, and within moments of having that mixture and laying down, I was completely out. And the next time I woke up, I woke up in post-op. So the whole blocking procedure was extremely professionally done. I went in for the operation, the anterior operation, and that operation takes around an hour, and that's all it is. It's 1 hour. And you can actually go to your records and look at the exact equipment that they've installed in your body, the exact, and I'll bring up a picture of the equipment right now. And that picture is what they installed in my body. And you can see it all online, and you can also see your X-rays. So let's get out of this pre-op. So now I'm laying in post-op. I'm recovering. I woke up fairly quickly. I was completely there. Didn't have any brain fog at all when I woke up. I was okay. I know where I am. Of course, I was joking around with everybody, and laying there with my new body part. And they have to start a course of various types of medicine. So they want to make sure you're not in pain. So they may give you opioids as on the high end of the pain. They may give you, for me, 2 Tylenol every 6 hours was just fine. They give you a blood thinner for sure, and that blood thinner is taken once a day. They give you an anti-inflammatory drug, and that anti-inflammatory is taken once a day, and then they want you to take a drug to control any infection. So they give you that as well while you're in the hospital, but only up to 24 hours, and after you're out of the hospital, you no longer take that drug. So really, for pain medication, there were three different levels of pain medication. The ones that are, I think, opioid types, there are 2 levels of that, and I ended up not taking those levels. I took the first. I'll put the names up. I can't get them right now because I'm holding my phone, but I'll put the names up of the medication that I took. But in the end, all I needed was a 2 Tylenol every 6 hours, which was amazing. I didn't have to take the second level or the third level of medication. The second level of medication made me sick the next morning. I wasn't throwing up, but I was extremely nauseated. It was a crappy morning until it wore off around 2 in the afternoon. So that was that. So now I'm in the hospital, and they're medicating the crap out of me. They check the wound to make sure it's fine. They put a bandage or on top of that wound, and it's one of those bandages that don't stick to the wound. It's very high end, and that's another thing you're going to have to do is buy yourself the appropriate bandage packs, and the nursing community at the hospital will let you know which bandage packs you need to buy. So now I'm sitting in the hospital, and I'm in a room with another guy, and he's a pretty good guy. Other than the extreme snoring during the evening, felt like I was in a tractor factory. But anyway, really, really nice guy. So he was there for other reasons. So I'm laying in my bed, and they're administering the drugs I mentioned earlier, and they're continuing to do that. And I'm getting some nutrition, I'm getting some food, and I'm getting through the evening. And now it's the morning, and it's time to get discharged from the hospital. So the first thing they do is they come over and they review the physiotherapy exercises that you need to do once you leave the hospital, and you go through those. I'll just go through them briefly. So one exercise is you're laying on your back, and your feet are together at the end of your bed, and all you're doing is moving your victim leg, the leg that got the new hip. You're moving that outward and inward, and you're doing it a few times. And when you do that, if you put a bag underneath the foot, it slides easier. So you're doing that. So that's one exercise. Another one is the heel slide, where you're simply lifting your knee up and you're sliding your heel on the bed. And you're trying not to lift your knee up too far initially because you don't want your knee to go further than your pelvis with this new hip for a while. So you're doing that. That's an exercise you do probably 5 to 8 of those initially, and that's all you do for those. And then they make you do an arch where you're arching your back. It's kind of like a yoga move. I found that to be too painful later on, and waiting till that sac that's around the joint heals before I start doing that arch, because it's for some reason my leg is in great pain when I do that arch, and I don't think the pain is worth it. So that's one of the exercises they do. Then they put a round tube underneath your knee, and you're laying down as well. And all you're doing is lifting your foot up. So your leg is kind of straightening up, and this big tube is underneath your knee. That's not a difficult exercise. And then they sit you up on the bed, and all you're doing there is moving your foot out and straightening your leg up and doing 8 of those. So that's basically all the exercises you're going to do until you're ready to do stand-ups exercises later on. And before they release you from the hospital, they want to make sure you can put full weight on that part, on that leg. And so they'll get you to stand up with your walker. And it's a walker, it's a 2-wheel walker, 2 wheels in the front and no wheels in the back. And when I first got that walker, I was kind of saying, well, why would I use this? I can use my other walker. It's got brakes on it. I kind of whined a bit. And the physiotherapist said, you'll need the 2-wheel walker because you'll need to be able to put full body weight on that thing. So the guy was absolutely correct. And so I should have just shut up. I needed the 2-wheel walker, hands down, or hands on the walker. So, so I used that 2-wheel walker. I stood up, put full weight on that leg, and for me there was no pain at all. I could put full weight, and they actually promote you doing that because once you start putting weight on that leg, the spike that goes inside the femur, the bone, where the marrow is, this will join with the bone itself and become one. And I think there's porous Teflon material on the outside of that spike. And it looks like something from the Wolverine movie. This is what someone told me. Again, maybe right now I'll put up a picture of that. And there you see the spike, and it's attached to the femoral head. Like I told you, I'm an electrical engineer, not a doctor. I just play one on TV. Damn it, Jim, I'm a doctor, not a surgeon. Anyway, so that's the head. So that spike goes in there, and it can take the weight of your body, and so can the cup. So it's a cup and ball situation, and the cup is in your hip. So they install that cup in your hip, and you can look up the installation procedures online. They are online for the product that they installed. So I looked up the specs, the installation, everything, so I know exactly what the doctor did. So anyway, you stand up, put some weight on it, and then you sit down again, and then they wheelchair you over to some stairs. They want to make sure you can walk up and down stairs with a cane, and they're assuming that there's going to be a handle on your stairs, like a rail in your stairs, before they release you. So you walk upstairs, and then you walk downstairs. And to walk upstairs, the good leg goes first, and the bad leg goes up. Then you take one step, good leg, bad leg, good leg, bad leg. To go down the stairs, the bad leg goes down with the cane, and then the good leg, and then the bad leg and the good leg. So luckily I'd been doing that for almost 3 years with the pain of arthritis in that hip. So I was well trained in walking up and down stairs. And of course I was joking around. So, and as you go by the counter in the wheelchair, make sure you order a Tim Hortons if you're a Canadian, a double on the way by, and the nursing staff will get a kick out of that. And it's a Dunkin' Donuts if you're from the US for that same thing. Order yourself a Dunkin' Donuts before you go, and be very kind to the staff. So there you go. So now you're able to go home. So let's talk about that. So now I'm home. I've got my bandage kit that I'm going to need 4 days after surgery. So they'll leave that bandage that they put on. You don't touch that for 4 days after surgery. So my operation was on a Tuesday, and I hadn't showered until Saturday. So it's not bad. You're not exercising. You're not sweating a lot. So it's not a bad thing. But you don't want to shower for those days. So Saturday was my first shower, and that's when the bandage was going to be replaced. So you're going to get your bandage kits. I did a lot of research on how to put a bandage on and all that stuff. There's not much. The bandage they put on will come off. There's kind of a netting thing above the scar, which means the bandage that they put on will not stick to the scar, which is nice. But the adhesive for those bandages are really good. They're very thin. The bandage they put on is likely going to be waterproof, the first bandage they put on. So when you take your very first shower, carefully, you can take your shower with that bandage on. And then after you've showered and dried off, absolutely, completely, because you want the scarred area to be dry, you dry off everything, lay down and get your spouse, partner, whoever's helping you to take that the current or the first bandage off, and then measure up how much bandage you need for the new bandage. So, And my plan is that every 2 days I'll have a shower and replace the bandage. I don't need to do that every day. I had a very nice scar, no leakage, no moisture, nothing. Everything was great. So the bandage replacement caused a bit of anxiety for me of how should I do this. There was no real good stuff on the internet about how to replace a bandage. It was all kind of crap. But really, when you lay down and you pick at the old bandage, just carefully roll it off, measure the new bandage. They gave me very long ones, and I was able to put the new bandage starting at the top, and then work your way down that scar. And you push on the edges of the bandage and not on the bandage itself. Don't touch the bandage itself in the center. Don't touch the scar. Don't put any creams on the scar. Don't do anything. Leave it alone. And then put the bandage on, and we cut the bandage about 2 inches at the bottom after the scar, and then use tape to tape the remainder. So that's kind of the bandaging. You're going to have to do that. But the first thing you do when you get home is you got to get into the house, which means you got to walk upstairs. If you've got no rail for that first set of stairs, get your partner to help you for stability, because you're really not that stable yet. You're unsure whether that new leg is actually going to work well. And then once you get in the house, go to your comfy chair. And make sure that you can sit down in that chair properly. And what I mean by properly is that the chair should either be higher than your knee when you're sitting down, or you can straighten your leg out in your knee as you lower yourself into that chair. And then after that, you're good. So I have a lazy boy. So lazy boy does get you a little bit low, but it's automatic. So the actual leg part goes up to bring your legs up. And you want to do that for comfort. So make sure you know how to get in and out of that chair properly and safely. I put the walker in front of the chair, push it away, and I'm able to get to the end of my chair carefully, grab the walker, move it close to me, and then able to get up using mostly the power of my arms and my good leg to get up. And then I can put weight and put weight on my newly operated on leg to get onto that walker. But you've got to practice that. So my biggest recommendation is practice walking before you go to surgery. Practice sitting down in the chair before you go to surgery. Practice picking things up before you go to surgery. Practice taking a bath as though you had surgery and you have that leg that you have to get over the bathtub. Practice doing that to make sure you know exactly what the process is going to be once you have to get in and out of a bathtub. The worst thing you can do is to actually fall. The doctors will tell you that, the nursing staff will tell you that. You do not want to fall, because you could damage that part and you could have to go back in for surgery again. So you do not want to fall. So practice everything as though you have had the surgery. Also, make sure that you have a plan for your pills. So you're going to get home, you're going to take, in the morning, you're going to be taking the anti-inflammatory pill, and you're going to be taking the anticoagulant, I think, or the blood thinner pill. So you're going to be taking, I think the blood thinner pill is in the morning and the anti-inflammatory is in the evening. Yeah, that's the way it goes. And for me, I just ended up with the 2 Tylenol every 6 hours, and that seems to be controlling everything. If you have to take the good stuff, as they like to call it, go to the mild stuff first. And if that doesn't work, go to the heavy stuff next, but tell your doctor, okay? That stuff makes me nauseated. And the very funny story is my youngest kid, who's actually pretty old right now, told me that my mom, when she got her hip replaced and she just flushed all that stuff down the toilet and she just took Tylenol. And everybody said, well, the fish were stoned. So anyway, be sure you know that the routine, and make a list before you go to surgery. Put it on a spreadsheet of when you're taking all this medicine, and note exactly when you're taking what medicine. So there's a record in case there's any issue that you have with taking all the medicine. But for me, again, I've got that 1 pill in the morning, that the blood thinner in the morning, plus the 2 Tylenol. And I've got the what is that other pill? The anti-inflammatory pill in the evening, plus the 2 more Tylenol. That happens around. The anti-inflammatory you've got to take with food. The blood thinner you don't have to take with food. But they'll let you know. The pharmacy will let you know what to take when. So you make sure you're ready for that. So moving around the house again, you've got to get exercise. You got to make sure you get your butt up. So every hour, you're gonna get up, and you're going to get your walker and you're going to walk around and do a cycle. So when you first start, just get up, walk around the house, and go back and sit down. Don't extend yourself too much. Don't overdo it. Take your time, because 3 times a day you're going to be doing those other exercises I mentioned with your leg. So you're going to want to take your walk, sit down, and then go to the freezer rather, and get those cooling bags and cool off the muscles that were used during those exercises. So that's why I said get 4 of them, because you can rotate them and get a little tiny cage or cart or something for the front of your walker so you can move things around. That's my advice anyway. And let's talk about how I felt through this whole thing. But before that, you're going to have around 4 to 6 weeks before you can drive. So your leg is going to be kind of getting better and better as you approach the 4th week. You're likely going to be walking by week 4, and maybe with or without an aid of some sort. And for sure by 6 weeks, you'll be driving and walking without an aid. But then you're going to continue with your physiotherapy because you want that leg to get stronger and stronger. It's likely going to take around 6 months to get to 80%. This is what I'm told. Although they're saying that the literature I've read said after 3 months, you can probably golf. You can download or go find literature that tells you what sports activities or what activities in general you can do at what period of time. And really the 3-month period is where you can start doing stuff like golf and those sort of exercises, or sports rather. Before that, you're simply walking and not much more. And don't overextend yourself, because what happens to a lot of people is they want to get back to their life. If they're younger, they want to get back to what they were doing in their sports, and you can damage that area. You can cause that hip to get loose. You can cause all kinds of problems. So you just have to take it easy, as painful as it is. And I'm one of those guys who just wants to get shit done all the time, and you got to just go through the process slowly, or it won't work. So that's pretty good. So let's talk anyway about how I felt about the whole thing. Well, of course, the worst thing for me was I couldn't stand up while I was singing karaoke. That's a joke. The other worst thing for me is I'm a guitar player, as you may know, and I do watchmaking as a hobby. Got a boatload of videos on this YouTube channel on watchmaking, and I can't sit at the bench to do that right now. Playing guitar is a bit iffy, even though I've got a guitar beside me. I'm going to try to just, put it on the couch and see if I can not use any bad muscles to play guitar. So for me, it's only been day 4. So let me just tell you how I felt. So before the operation, there's a bit of anxiety. You're a little bit nervous about the whole thing. Read. Watch YouTube videos. Get knowledgeable about what you're going to go through. It's your body. It's not the doctor's body. It's yours. So read and get very knowledgeable about everything. And like I said, practice. If you were going to the Olympics and you were high jumping, you'd be practicing for 4 years before the Olympics. You're going in for major surgery, and you're going to have to operate after surgery. You're going to have to be able to maybe feed yourself and walk around and all the things I talked about, and taking a shower and getting in and out of bed. In and out of bed is not that difficult, and there's videos on how to do that. And you're going to have to do that. So practice all of that before the surgery. Then when you get the surgery, you know what you're doing. There's no issue. So I felt a little bit of anxiety. They're going to be digging into my body. I was concerned about the pain. So today, pain management is so good, it's sickening, right? I went in there, and I'm telling you, the only pain I had was when they jammed that needle into my left hand, and then they realized that the vein wasn't right. So they decided to jam it into my right hand instead. That was the worst pain the whole time. The surgery, I felt 0 during the surgery. I felt 0 after the surgery. With the Tylenol approach, I have pretty much felt 0. The only time I've felt any pain is when my left leg, where I had the surgery, accidentally went back a little bit too far. And you're not supposed to do that. You're not supposed to walk backwards or lunge backwards with your left leg. And you're also not supposed to bring your knee up really high. And you're not supposed to pivot your foot outward. There's a few don't do's, and you can look those up. But there's just a few. So you got to make sure you don't do that so the hip doesn't pop out. But from a pain perspective, pain management is amazing nowadays. So don't be concerned about all the pain you're going to have and everything else. You will have some bruising on your leg for the surgery. With the anterior approach, the bruising is minor. My bruising was very minor. no real issues there. So I was very happy, and I've had no real pain or bruising to date, and it's day 4. So, and my real anxiety was bandage change. So I'm really looking forward to being able to get in the car and go somewhere with my wife. She's going to be driving, of course, and then doing some watch work, playing more guitar, getting up and walking around more without aid of a device. But the most amazing part about this whole surgery is that arthritic pain that you had, that aching you had in your hip, is gone. And when you go to sleep at night, you're sleeping on your back, which is a little bit difficult to fall asleep on your back if you're not used to it. But there's zero pain, and I found that this part was just amazing. I spent 3 years putting cream on my hip every night, around 3 times in the evening, because the cream would only last around 3 hours. So I'd wake up in pain, put the cream back in my hip, go back to sleep, do that whole routine over and over again. And I haven't noticed any pain in my hip at all. And so you'll just be so happy with this. This is a life-changing surgery. Don't think twice about getting it done. Get it done. Don't say, oh, I'm afraid. There is no pain involved. Actually, go there with a good attitude and the approach that this should be fun. I'm a real joker, and just as a last note, I'll tell you what I did. So I had a very big battery with me to charge my cell phones while I was overnight in the hospital. And what I did was I took the cord for the battery and I stuck it under my butt, brought the nurse over, and when I pressed the button, the light would go on in the battery and made my knee go up. And then I pressed the button again, light went off, I made my knee go down. Then I made it go up and I made it go down. I said to her, this automatic battery powered hip is amazing. And for a moment, I'd say 30 seconds, she believed it. And we all had a really good laugh over that. So I hope this video, it's a bit long, but I hope this has helped anyone who's curious about what you go through for complete or total hip replacement. Lots of literature online, a lot of videos online about this, so go see them. But my experience has been excellent. The surgical team were all professionals. Pain management is incredible. So don't worry about any of that. Just make sure, the biggest tip I have is to practice all of your routines that you're going to be using when you get home before the surgery, so you know exactly what to do when you get home. Get 2 walkers if you've got an upstairs and a downstairs, and leave one downstairs, leave one upstairs. The walkers I bought were 58 bucks Canadian. That's nothing compared to the convenience of having 2 walkers with you. Buy a shower chair, buy an extended shower chair if you need to slide over, and get your partner to help you with showering initially until you get enough strength where you can shower on your own. And buy all the equipment I said way ahead of time. Make sure you're comfortable with everything as you're well prepared. So I'm JD again, and thanks a lot. I've gone through total hip replacement. I have a lot of support from friends. Thank you all to all the Facebook friends I have out there, to all the watchmakers out there who said, good luck with your recovery, JD. So everything is going well right now. I wish I could sit at my bench and do watchmaking, but I can't right now. But I'll entertain myself somehow. I'll play some guitar for sure. So thanks all for your support. Thanks for the support for my YouTube channel. I hope this has helped a bit, and I'm going to process this video and put some pictures up of all this stuff so you can better see the equipment that was used and everything else. So I'm JD. Please subscribe, please hit like, and have a great day. And let's go on to the next phase of this total hip replacement surgery. And thank you very much for the medical staff at the Queensway Carleton Hospital. You guys are wonderful.